Hello, everyone. Good morning. My name is Deontay J. Marquis, and I am a family nurse practitioner and registered nurse for the past 10 years. And today we will be talking about Alzheimer's disease, the disease, and latest research. And again, my name is Deontay, and I will be doing this presentation on behalf of myalftraining.com. So, without much further ado, let's begin. There we go. Okay, so first, as I usually do, I want to review over the course objectives for today. Now we have 5. So the course objectives is just what I want you to take away from today's presentation, the most important information that you can take, and things that I want you to not just take away from the presentation today, but understand, be able to implement into your practice wherever you are, and have it benefit you to provide excellent patient care to help evolve you as a caregiver. So, first course objective is I want you to leave here being able to understand and define exactly what Alzheimer's disease is. Now, some of you may have an idea of what Alzheimer's disease is, but there's a little bit more behind the scenes that I'm going to go over with you today, and also help to clear up any misunderstandings a lot of times with mental health. I find that newer nurses or nurses who just haven't been in contact with mental health care or mental health care patients, we confuse the diseases or have trouble remembering the specifics of each. So that's what we're going to clear up today with course objective number 1. Now, course objective number 2, at the end of this presentation, you will be able to describe the nation's current and growing problems that Alzheimer's disease brings to healthcare. Now, you may have heard in your community or at chatting with friends or at your workplace that the elderly population in America is continuing to grow and grow into such a large number. And in the near future, 10 to 15 years, that group of society alone will have a very big impact on healthcare as we have come to know it. So we're going to talk about that today, and you're going to be able to describe a little bit more about that impact and the specific problems that Alzheimer's disease will bring to healthcare. Our third course objective for today will be able to help you identify any early warning signs of Alzheimer's disease and the symptoms that differentiate initial Alzheimer's disease from its progressed states. So there are a certain amount of progressed states of Alzheimer's disease, and we're going to get into the specifics of how to differentiate between those stages so that in your care with your patient, you can assess them and use this detailed information to give a report to other nurses, doctors, or family members who may be calling for updates. Our fourth course objective for today, we are going to be able to understand current screening, prevention, and treatment methods. So this is just pretty standard with every disease. We want to know, how can we screen for it? What can we do, if anything, to prevent it? And in the case, if it is such a prevalent disease, Alzheimer's disease, as we've all heard about and we'll talk about today, what are the treatment methods? How can we help people who are suffering from Alzheimer's disease? So that's going to be our fourth course objective for today. And last but not least, our fifth course objective, you'll be able to leave here with an understanding of future screening, prevention, and treatment methods that are under development. So this is big, and especially for me, because when you talk about these scary diseases and how they're getting worse and worse, nobody really touches on future screening or prevention. They're just trying to give us the understanding, almost by scaring us, it feels like sometimes, that this is a disease we need to be on the lookout for, and this is how we need to treat it and combat against it in our healthcare. But what we're going to focus on in this last course objective is understanding future screenings and preventions and different ways we can treat this disease, which is projected to grow in the next decade at enormous rates. So let's get into it. First slide, we're going to talk about what is Alzheimer's disease. What is it specifically? Well, Alzheimer's disease is, as you may or may not know, the most common cause of dementia. Now, let's stop there. Dementia. What is dementia? Well, dementia, if you look to your right, at the graphic I have there, is an umbrella term for loss or memory. So it's just the term that they use to describe a abundance of symptoms, which are also symptoms of Alzheimer's disease. But dementia is just an umbrella term for memory loss and other symptoms, confusion, significantly decreased vision. So dementia is the term that has been applied to a group of symptoms. It's not just one single disease. It references what disease those symptoms might be related to, but it cannot be determined exactly what those symptoms are related to. So they call it a form of dementia. Does everyone follow? I hope so. I know you do. So dementia accounts for almost 3/4 of all cases of dementia in the United States. And Alzheimer's disease accounts for the majority of those. So when you say someone has dementia, you may not know that they have Alzheimer's disease, but they likely do, because as I said, 3/4 of all cases in the United States are related to Alzheimer's disease. But if you hear someone say, oh, this woman or gentleman has dementia, it's very likely that they have Alzheimer's disease. But whoever said that isn't certain, or maybe the patient's doctors can't be certain that they have Alzheimer's disease. Maybe it hasn't developed into that stage. Maybe they don't have enough information to make that diagnosis, or maybe they don't have Alzheimer's disease. Maybe they're the other 1/4 that's suffering from some other type of disease that's causing short-term memory loss and other trouble with their daily life related to their cognitive ability. And those diseases I have here. Lewy body dementia accounts for 5 to 10%, vascular dementia 5 to 10% as well, frontotemporal dementia, and then there are other types of diseases that are underneath that umbrella term, which is Parkinson and Huntington's. But Alzheimer's disease, as you can see, is the biggest raindrop that's getting past this umbrella and making a puddle of the different types of dementia. So I hope we cleared that up. Dementia is not the name of just a single disease. Dementia is an umbrella term used to identify a group of symptoms. And Alzheimer's disease is a type of dementia. So moving on. So why is Alzheimer's disease so important? Why are you watching this presentation? Why are we talking about this for the next hour? Because 13.8 million people aged 65 and older are projected to have Alzheimer's disease in 2050. Now, that number may not be a jaw dropper for you, but if you consider that 5.8 million Americans aged 65 or older today have dementia, that means in the next 30 years, 3 decades, this disease is not only going to sustain such a high level that it's affecting people in the United States, but it's actually going to triple. And that will leave us with almost 2 out of every 3 women will have Alzheimer's disease that are age 65 and older. So maybe those numbers are a little bit more jaw-dropping, those relations, if you just think about how prevalent this disease is in society already today, and it's going to be tripling in the next 10, 20, 30 years. Now, specifically, Alzheimer's disease is most prevalent with African Americans and Hispanics and women. Those are the three groups of society that Alzheimer's disease affects the most: women, African American, and Hispanics. And of course, considering the factor that the individuals in that group are age 65 or older. Now, African Americans are twice as likely to have Alzheimer's disease if you compare them to their older white counterparts in society. Hispanic Americans are 1.5 times as likely if you compare them to older white counterparts. So African Americans are twice as likely to get it, and Hispanics are second after them to get it. And women under each ethnicity are of the higher prevalence of individuals suffering from Alzheimer's disease. So those are some numbers, those are some stats just to get you guys to really grasp how serious we need to be taking this disease and how serious it's affecting our patients, and most importantly, how common it is among our patients, whether it's been diagnosed or not, or whether we've acknowledged it or not. This disease is out there and it is affecting a numerous amount of our patients. So that is why it is so important. Here, if you're more of a visual learner like myself, is a visual chart to demonstrate the prevalence of the disease and the projections for it within the next 30 years. So you can see we're at 2020, and the individuals of this color are late stage cases who require almost one-on-one care, almost as much attention as you would give a small child to keep them safe, to make sure that they're well taken care of. And this is the blue individuals are the number by 2 million people in society who are suffering from early stage. So they've just been diagnosed, or it's only slightly progressed, and they don't need as much support to complete daily activities. They still maintain some type of autonomy and make decisions themselves. But just look at how the individuals who need our full support to care for them on a day-to-day basis, just look at how that number nearly doubles here in 10 years. And then here it's fully doubled from 2020, probably a little bit in excess. And then if looking at the people, don't even look at the numbers. You can see how big the jump is compared to here. It's probably tripled in access. So almost tripled in access. So as you can see, this is why visually, as you can see, this is why we're talking about this for the next hour. It's been talked about hopefully in your hospital before, maybe in conversation with friends, maybe you've read an article online or in school about how serious we need to take Alzheimer's disease and prepare ourselves to care for patients who are suffering from Alzheimer's disease, and become more educated about the disease to do so, to provide them with the type of care that they need. So, Alzheimer's disease, we talked about who it affects. We talked about age and race, but there are two other specific individuals in society that Alzheimer's disease targets and is prevalent amongst. So, quick review: age. Most individuals age 65 and older. We talked about that on the previous slide, that Alzheimer's disease really seeks out individuals who are age 65 and older. But after age 65, Alzheimer's disease only gets more prevalent. The risk that an individual will develop Alzheimer's disease doubles every 5 years. Every 5 years, the risk doubles. So as our patients and family and loved ones get older, their risk of developing Alzheimer's disease increases. And after age 85, the risk reaches nearly 1/3. So that's huge. Race: African and Hispanic Americans are most likely to develop Alzheimer's disease. So think about your patient population where you work. Think about the society population surrounding that area. Individuals who are not 65 yet, but all the individuals who will be within the next 10 to 20 years. We really need to focus our care and efforts on preparing for Alzheimer's disease because of the level of care that patients who have Alzheimer's disease need to live a comfortable life and be taken care of safely. So now we're moving on to the next two characteristics that put an individual at increased risk for Alzheimer's disease. And those two characteristics would be head injury, so individuals who have suffered from a head injury, or heart head. And we'll talk about what heart head means in a moment. So head injury, there is a link that scientists have found that patients who have suffered any type of head injury are at an increased risk to develop dementia. And there's actually a correlation, so there's a correlation between individuals who have had a head injury and develop dementia. So if you think about in society, famous boxer Muhammad Ali, he was a boxer, he suffered head injury, and now he developed Parkinson's disease. So if you think about Parkinson's disease on the spectrum of our umbrella term dementia, some people say he has dementia, but actually Parkinson's disease is a type of dementia. We talked about this. So just look at how small the raindrop was to get an idea of how rare it was for him to develop Parkinson's disease. So there's a link between head injury and future risk of dementia, as evidenced by Muhammad Ali taking, the trauma to the head when he was boxing. Now let's think about the average American. So individuals who were in car accidents, individuals who were victims of violent crimes, who were hit in the head, or older individuals who had a stroke and maybe they fell and hit their head, or our elderly grandparents or aunts and uncles that fell while they were in care at a care facility, and then they recovered from the head injury, but we noticed things started to change. That kind of marked the point at which things started to change. And it may be linked to the head injury, but it also may be linked to the rapid onset development of Alzheimer's disease because of this correlation that scientists have found. So Alzheimer's disease, it affects you based on age, race, whether you suffered a head injury, and also heart to head. So what heart to head here is referring to is individuals who have health conditions that have damaged their heart or their blood vessels. So patients who have had a stroke, who suffer from high blood pressure, high cholesterol, anything that is that makes it difficult for the cardiovascular system to circulate blood. So individuals who have additional, if you will, plaque build up in the plumbing of their bodies, in their veins, in their blood vessels. Heart to head means that they are at an increased risk of developing Alzheimer's disease. So this is why we need to understand our health plays a huge role in predicting our risk for a very wide group of diseases. So a person could be healthy and not have any serious health issues, never had a stroke or a heart attack, but suffer from high blood pressure and high cholesterol. They need to understand that, without taking their medication and without proper diet and exercise, they remain victims of high blood pressure and high cholesterol. And the end result of that can be developing Alzheimer's disease. So age, race, head injury, and heart-head correlation are all factors that increase a person's risk of developing Alzheimer's disease. Now, what is this impact on healthcare? A few more numbers for you guys, because we are math majors, right? No, uh, we're science majors. Well, some of you may have been math majors, but so Alzheimer's disease, the impact on healthcare. Alzheimer's is the only top 10 cause of death in the United States that has no known cure. So I'm just going to repeat that to let that sink in. Alzheimer's is the only top 10 cause of death in the United States with no known cure. It's the only one. Every other top 10 killer in the US, scientists are working, developing a life-sustaining treatment or a reversible cure, except for Alzheimer's disease. That's huge, especially if you think about the numbers that we talked to at the beginning of this presentation to demonstrate how prevalent the disease is now and how prevalent it's projected to come in the next 10 to 15 years. So let's read a bit further. In 2020, Alzheimer's and other dementias will cost the nation $305 billion, including $206 billion in Medicare and Medicaid payments. In 2050, Alzheimer's is projected to cost more than 1.1 trillion, and that's in 2020 dollars. So that's not accounting for increase in the dollar. This is fourfold increases in both government spending under Medicaid and Medicare. So what this is going to show is that Alzheimer's disease is going to take a significant chunk out of the budget that we have allotted for individuals who need life-sustaining treatment, who are younger, because we're going to be spending a lot of that money to take care of older patients who need help just as much, but they're suffering from Alzheimer's disease, and this is something that we've known about since 2020. And in the year 2050, we're going to be paying 4 times the amount of money to help care for these patients. So this means premiums on insurance and healthcare. The prices are just going to get higher because these insurance companies have to have enough money to pay for the treatment of these individuals. So this is why this is important. This is why this is important, and we are learning about this today. So signs and symptoms. How do we know if an individual may be suffering from or is teetering on developing Alzheimer's disease? So, early warning signs. Memory. That's usually the first thing that's reported to go is an individual's memory. We notice subtle changes. They're reported as getting older. If they are approaching upon the age of 65, your mother, your loved one, spouse, friend, it doesn't hurt to go to the doctor and get checked out just to be sure that the memory loss that you're experiencing is normal and it's not abnormal and something that we should worry about. Otherwise, how do we know? So if you're caring for a patient and family has been telling you that they're suffering from memory loss, or you're suspecting that their memory is decreasing, suggest to the doctor that they be tested or studied for early possible development of Alzheimer's disease. And what this can do is buy them a little more time to begin preparing themselves, their family, and maybe even strengthening their cognitive muscles to ward off Alzheimer's disease from worsening sooner than it would have if you didn't say anything, if you didn't let the doctor know that the patient had some memory loss. Memory loss that disrupts daily life is not a typical part of aging. So you need to make the decision, being close to whomever that you may believe is developing Alzheimer's disease, that the memory loss that they're suffering from is affecting their quality of life. It's making them unhappy. It's frustrating them. And we need to step up and try and help them by suggesting they go get help. So what are some other signs and symptoms of Alzheimer's disease? Well, memory loss, we talked about that as being a big one. Trouble completing familiar tasks at home or work. So if a person does the same thing every day, let's say my grandmother wakes up, opens all the windows, and she makes a specific type of pastry from scratch. And I go over to her home one day. She wakes up, all the windows are open. I smell that she's cooking. But for whatever reason, the pastry that she makes every day is burning in the oven. So she's upset. I came over to have breakfast with her. She's upset because breakfast isn't ready. And I find that she's not putting any flour in the pastry. Um, and she's not putting in any other key ingredients that she usually has spot on every time. This is a warning sign that something's not right. It wasn't just that maybe it wasn't just that grandma didn't have her coffee in that morning. Maybe it's something more serious going on. So we need to be aware of our loved ones' habits, their lives, what makes them happy, and this way we will be the first to know and report early in this type of behavior as an early warning sign of Alzheimer's disease. Making poor judgment, social withdrawal, mood changes, maybe mood changes that aren't appropriate, laughing in sad situations, crying hysterically in situations that should be funny to you or I. So these are some early warning signs. They are subtle, but they need to be caught as soon as possible. Like I said, this will give doctors a chance to make an early diagnosis and your loved one some added time to seek out treatment to reduce the effects of Alzheimer's and to make their plans for the future if and when the Alzheimer's disease progresses to a later stage. So here we are. One of my favorite slides. This is the stages of progression of Alzheimer's disease. So these are the 4 stages of Alzheimer's disease. This is what we've been talking about, the different stages. But before we jump in here, I want to show you guys a video about one other way to make an early diagnosis of Alzheimer's disease. And we'll talk about this after.
Though she spends much of her retirement traveling the world, Emily Schornstein still finds time to help with medical research. Emily is a retired nurse who volunteers for studies involving Alzheimer's disease, which can sometimes call for some very invasive procedures.
Yeah, I've done MRIs and CAT scans, and even an LP, lumbar puncture.
But now she's testing a new approach. This one simply involves a pen, paper, and a few minutes of her time. It's called a SAGE test, and a new study shows it can reveal volumes about a patient's mind.
What we found was that this SAGE self-administered test correlated very well with the very detailed cognitive testing.
Dr. Douglas Shari and his team at the Ohio State University Wexner Medical Center developed the test. They gave it to more than 1,000 patients over 5 years and found that nearly 30% showed signs of dementia they didn't know they had. By repeating the test from time to time, doctors now have a cheap and easy way to monitor their patients and detect even slight changes in their cognitive ability.
If we see this change, we can catch it really early, and we can start treatments much earlier than we did without a test.
Which is crucial. Studies show most Alzheimer's patients wait 3 to 4 years before being treated. That's not likely to happen to Emily. In all her travels, she's collected elephants from all over the world, which is only fitting for someone committed to helping preserve memory by taking part in studies like these.
It's a way to maybe help me or help somebody else in the future.
At Ohio State's Wexner Medical Center, this is Clark Powell reporting.
All right. So I want to bring that up because we talked about signs and symptoms and early warning signs of Alzheimer's disease. So what they showed in that video is a test called the SAGE test that you can administer to an individual repeatedly at different intervals. So maybe once a month, once every 2 months, once every 3 months. And what this test does, it studies their cognitive ability, and you can track their progress over a certain amount of time to see if it declines, it maintains, or it gets better. And what this test specifically shows you is it detects early stages of Alzheimer's disease by significant changes, declines in their score on the test. Now, in case you didn't catch it, the name of the test, I'm sorry, is SAGE test, SAGE, and that stands for the Self-Administered Gerocognitive Examination. So if you want to be proactive, whether it's at your place of work, whether it's with your family members, whether it's at a hospital, or just to take it for yourself, to monitor your own well-being. You can look up SAGE testing, and there are downloadable tests for you to take or issue to another person, or you can mention it to your healthcare practitioner, or the healthcare practitioner or physician at your place of work, and suggest that they implement the SAGE testing. When you do, tell them Deontay sent you. So this is something that I really am looking forward to being included in the care of individuals age 65 and older, who aren't currently displaying any symptoms of Alzheimer's disease, and just another tool in our bag that we can use to detect, prevent, and get ahead of treatment for patients who become afflicted by Alzheimer's disease. So that is a future of the research there. Okay, now before we get to the treatments, I want you guys to understand more about the stages of progression. So there are 4 stages of progression. There's mild cognitive impairment, then there's mild Alzheimer's, moderate Alzheimer's, and severe Alzheimer's. So what essentially happens is the disease begins in the medial temporal lobe, and it spreads to the lateral, the parietal, in the back, the frontal lobe, and then our occipital lobe, which is a more focused point, and that's where the vision is. So what this does is, if you understand the stages of progression, then you understand more about how intense, you understand more about the intensity of the treatment. You have more realistic ideas and views about expectations of the treatment that'll let you know whether what you're doing is effective. And ultimately, this will guide us to provide better care for the patient, because now we know exactly what type of treatment they'll need, how intense it needs to be, and what are realistic expectations to show any benefit of our efforts to help reduce or slow the progression of Alzheimer's disease. So these are the 4 stages of progression. Diagnosis. So we talked about the early warning signs. We talked about signs and symptoms. We even talked about the SAGE test, which we can give before individual even shows signs or symptoms of the testing, any signs or symptoms of Alzheimer's disease on the testing. And we can use that to say, hey, there was a sharp decline over the past 3 months. I think you might be developing Alzheimer's disease. It sounds crazy, but that is essentially the best way to get ahead of it. And if you think of it in terms of the brain is the same as when we go to get our blood test. We go to get our blood test to see if all the numbers are pretty much the same the last time we went. And if something isn't the same, then the doctor lets us know, and he tells us, hey, your your CBCs, your blood level was off. I think this may be a problem. I think B may be a problem, or C may be a problem. And this is that the stage test will be the same way. But there are different types of tests to diagnose the patient. The stage test cannot be used to diagnose the patient. There's actually a more specific type of test that doctors use, a more standard mental status test, just to assess a patient's mental status to get an idea. Or there are psychological tests that have to be administered by a neuropsychologist. Also, doctors can perform a physical exam. They can take a family interview and talk to the son, the mother, or the brother, or the spouse to collect data and information about, what type of changes have you noticed with your loved one? Are they having memory loss? How is their speech? How is their vision? Those types of things occur in the family interview. And based on that information, the doctor can make a diagnosis of Alzheimer's disease or maybe some other type of dementia. But the most specific testing are brain image tests. And that would be a CT, an MRI, or a PET scan, basically to detect the areas of the brain here, as we saw. And what they're looking for is occlusion in the ventricles, not the ventricles, I'm sorry, the matter of the brain that has coiled. We'll talk about that. Also, lab tests. Lab tests have to be used with Alzheimer's disease because the doctor wants to rule out B12 vitamin deficiency, which also can cause memory loss and other symptoms that are similar to those we'd see in someone who actually does have Alzheimer's disease. So, the future of diagnosis. So we talked about what doctors do now, currently, to diagnose individuals who are believed to be suffering from Alzheimer's disease. Well, what is the future going to look like for the diagnosis? What type of progress can we expect? What are the differences going to be? How are we getting better at diagnosing this disease? That, as we just talked about, is growing so rampant in the next 10, 20 years. Well, there's something called tau, T-A-U, protein biomarker detection. So, if you heard me on the last slide, I mentioned tangles in the brain, and that is where they would take the images from the MRI to note those changes in the different areas of the brain as the disease spreads and grows to different areas of the brain, causing different symptoms. So I mentioned the tangles that they're looking for in the brain imaging test, the CT, the MRI, the PET scan. So the future of diagnosis, if that's what we're looking for in the brain, in the future of diagnosis is looking for abnormal deposits of proteins or plaque, the same way an individual with atherosclerosis has plaque built up inside of their blood vessels, their cardiovascular system, that's making their cardiovascular system work less efficiently and is going to eventually lead to them having a heart attack because there's too much plaque, the plumbing in the side of their body is clogged. That's how this plaque works in the tau tangles throughout the brain, which eventually lead to memory loss and cognitive impairment and the development of Alzheimer's disease. So currently, Alzheimer's diagnosis can only be confirmed with certainty, with 100% certainty after death. That's another jaw-dropping stat for me, is that only after a person has died can they diagnose them with certainty of Alzheimer's disease. Now, the doctor will likely be very certain in their diagnosis if they've told a patient that they have Alzheimer's disease. They have likely ruled out vitamin B12 conducted a physical exam, a brain imaging test, a family interview, and if the patient was in the earlier stages, some type of mental test, and they've tracked it and trended it. But with absolute certainty, after death is when Alzheimer's disease can be diagnosed. Now, when we're talking about plaque in the tangles of the brain, this is a visual to give you a little more understanding. I'm not 100% versed in the brain, the neurological system, or how amyloid plaques and proteins cause tangles, but I have an understanding of it. So, as you see here, this is a plaque that clutters up the neurofibrillary tangles. So it makes it difficult to carry information, to sense information, and you could see why memory loss would occur, because this plaque builds up. And if you think of a memory as like an electrical current trying to transfer from here to here, with all this plaque, it makes it very difficult to get that information out. And this plaque occurs as it spreads through the different areas of the brain, resulting in different symptoms. So early warning signs probably will begin here, and then as you see the tangles get worse and spread to different areas, here it's in the occipital lobe, so the symptoms get worse. So this is what we're talking about, amyloid plaque, tau tangles, just to give you a visual for the terms, because they are, I'm sure, very new, as they still are to me. All right. So, Alzheimer's disease, tau protein biomarker detection. So actually, TOVID is a radioactive diagnostic agent that has been approved by the FDA by a company called Lilly for PET imaging of the brain. So what the PET imaging is, they've learned to do is to look for areas of the brain where there is a very increased or dense distribution of the tau angles. And specifically, they're looking for this in patients who are being evaluated for Alzheimer's disease, and using TOVID, which is this diagnostic agent, highlights those dense areas of tau tangles to confirm or rule out Alzheimer's disease. So it's pretty amazing work, pretty futuristic, advanced technology that allows them to do this, that will help us to better diagnose and therefore treat earlier patients with Alzheimer's disease. So I just want to see if I can pull up this video from the company for you guys. No, we can't. Okay. So anyway, no problem. So we talked about TOVID. This is the radioactive diagnostic agent that a company called Lilly is going to be producing for the world to use future diagnosis. So this is a statement that I was able to pull from them, even though I wasn't able to pull up the video just now. That's why I put this quote from them here. So Risa Sperling, she's the professor of neurology at Harvard Medical School and director of the Center of Alzheimer's Research and Treatment in Massachusetts General Hospital, says that the use of diagnostic imaging can help patients and their families plan for the future and make informed choices about their health and well-being, in addition to facilitating appropriate patient management for physicians. So that's specifically from her mouth, a person who is has a lot of clout inside of the neurology, Alzheimer's research division of healthcare. That's how she feels about TOVID and tau protein biomarker detection. She also says, determining the anatomic distribution and density of tau in the brain was previously possible only at autopsy. Now we have a way to obtain this important information in patients. So first, it was only available, as we said, when someone was dead, when they had passed away, to conduct an autopsy, but we knew that we knew what we were looking for. We knew that we were looking for the tau tangles inside of the brain. So they were able to go conduct an autopsy, look for the tau tangles, and confirm and say, yes, this patient had Alzheimer's disease, as evidenced by the tau tangles in this densely compacted area. And judging by the signs and symptoms that this patient was complaining of prior to death, we estimate that the tau tangles are now spread to a certain area of the brain. And we know through this presentation that based on the location of the tau tangles in the brain, it dictates the specific stage of Alzheimer's disease. So they were able to tell all of this, and they knew all of this, but now Lilly has created TOVID, which is going to help doctors to evaluate individuals for Alzheimer's disease. So this is an article you can read more if you're interested, which I strongly suggest. They just received FDA approval this year, so something great that's going on in 2020. It's the first and only approved diagnostic agent to image tau neurofibrillary tangles in the brain. I believe if hospitals take serious, which many of them are, the threat to healthcare that Alzheimer's disease poses, they will adopt TOVID use into their practice to help with early detection and pass those benefits of early prevention and planning to their patients by using TOVID to diagnose. So, treatment. How do we treat an individual that we know has Alzheimer's disease? They've been diagnosed. Let's say they were at a hospital that was two steps ahead of the game, and the doctor believed that the patient may have had Alzheimer's disease as evidenced by the symptoms that they were displaying, and they conducted the family interview. Now the patient received TOVID, and they were able to see the patient indeed has tangles inside the brain, so they need treatment. What is the treatment for a patient who has Alzheimer's disease? How do we restore a person's memory loss or stop them from making poor decisions, which is also a sign or symptom of Alzheimer's disease? Well, unfortunately, there is no direct treatment for the disease. The treatment of the disease is aimed at symptom management. So here are the 4 specific, but not limited, medications that are used heavily to treat individuals with Alzheimer's disease. So anticonvulsants. Patients with Alzheimer's disease have mood swings. Sometimes they can be, as we talked about, they may laugh during situations which they're supposed to cry. They may cry during situations which are funny. And also they can be nice when other people would be very upset, or they could suffer from aggression. So anticonvulsants are sometimes used to treat those patients with Alzheimer's disease who become aggressive in aggressive episodes. Antipsychotics. They're drugs used to treat paranoia, hallucinations, agitation, and aggression. So that is what you would guess antipsychotic would be used, and they are used on patients with Alzheimer's disease. Sleep aids. Patients with Alzheimer's disease should use sleep aids, but they shouldn't use them regularly, because what can happen is it'll actually make the person more confused, because they'll start confusing day and night, and that just doesn't work well. It throws off their circadian rhythm and actually has shown some likelihood to increase falls in patients who start taking sleep aids on a nightly basis. Last but not least, Namenda, as I have pictured here. I've given this to patients several times. I'm familiar with it. It's also called memantine. It treats moderate to severe Alzheimer's. And what it does is decreases brain cell death by restoring the protein glutamate to help patients better maintain their independent functions. So what you can think of, this drug actually prevents brain cell death from the plaque and that's built up in the vessels that may be decreasing the amount of oxygen, nutrients, or blood flow to a certain part of the brain because of the tangles and plaque that's built up distal to that point. So to keep those brain cells from dying, you give the patient Namenda, and it prolongs the life so the patient can prolong their independent functions. SAGE testing, we talked about SAGE testing, but again, just want to put this in here to remind you guys, this is something that we should be suggesting to use to help benefit our patients. It's just another tool in our arsenal, the self-administered gerocognitive exam. Alzheimer's disease. Currently, there are 5 Alzheimer's drugs approved by the United States Food and Drug Administration. There are a lot more drugs in the pipeline, but these specific drugs are a little bit further down the pipeline, and most of them aim to interrupt the disease itself by making the brain, by stopping brain changes that are associated with Alzheimer's disease. So, and it's expected to not just be one single pill, but a group of pills is similar, with very similar actions that work together as medications for patients with AIDS do. So one pill helps another one, and they all try and do one job. All right, guys. We have reached the end of the presentation. I have 2 review questions for you guys, and then that's it. Then we're done for the day. So let's jump into it to see how well you were paying attention and whether you were able to pull out the information that I needed you to become a better healthcare professional. So our first question: are nurses educating a patient during discharge about risk factors that may increase their chances of developing Alzheimer's disease? Which of the following is incorrect? So which is not a correct risk factor of a patient who's asking about their chances of developing Alzheimer's disease? All right, give you another 10 seconds here. Make your final answer, and your final answer should have been BMI. Now this question, I will admit, was a little tricky if you weren't sure, because BMI also suggests a lot about a patient's health. It suggests that the patient is overweight, so knowing the BMI would increase chances if the patient has a high cholesterol, high blood pressure, because patients with a BMI that's higher, they're usually overweight, and overweight indicates a sedentary lifestyle, which is more correlated with high blood pressure, high cholesterol. But I didn't say the patient had an increased BMI, and this isn't one of the risk factors that we talked about. The risk factors that we talked about were age, race, head injury, Family history, I didn't include it, but I did touch on it briefly. So age, race, head injury, and family history, genetics, always we develop our disease from genetics. So BMI is not, does not necessarily increase the risk. Maybe that question was a little too tricky for you. If so, I apologize. Question 2, this is where you can redeem yourself. Which of the following patients is most likely to develop Alzheimer's disease? Is it A, a 56-year-old male? Is it B, a 55-year-old African-American female? So AA is African-American. 67-year-old Spanish female, 75-year-old African-American female. So I spent a lot of time about this, enforcing the differences in risk as it relates to race and age. So hopefully you were paying attention. And if you were, then you would have selected, drum roll, you would have selected D as your answer, because Alzheimer's disease affects individuals age 65 or older. So automatically A and B, we shouldn't be looking at. So now we're just trying to decide which patient is female. So both of those patients are female. So now the only difference is age and race. So we're looking at the race, and we know that African Americans are 2 times more likely, and Spanish or Hispanic Americans are 1.5 times likely. So our older African American female is more likely to develop Alzheimer's disease than patients A, B, and C. So that's the end of the presentation. We'll just do a quick review, make sure we've talked about everything. We can check off everything on our list. You should understand and be able to define what Alzheimer's disease is. We talked about this. We talked about dementia just being an umbrella term. We talked about the signs and symptoms of Alzheimer's disease. We talked about the stages of Alzheimer's disease and all of the other types of Alzheimer's disease that were underneath that umbrella. So we can definitely check off course objective 1. Describe the nation's current and growing problems Alzheimer's disease brings to healthcare. We spent a good deal of our time on this today. I was trying to get you guys to really understand how prevalent the disease is and its projections to become even more prevalent in society, and also the amount of money that it's going to cost to care for these individuals. And we even used a picture graph for our visual learners so they could see how not only the number of individuals with Alzheimer's disease, but the number of individuals with progressed stages of Alzheimer's disease that would be needing more of our care would double and increase over the years to 2050. So we can check off course objective 2. Course objective 3, identify early warning signs and the signs and symptoms that differentiate progression from early to progressed states of disease. We talked about this specifically, the early warning signs and the symptoms. We talked about memory loss, how that's usually the first to go. I gave you guys an example using me and my grandmother of how simple things that our loved ones may forget or lose track of can be an indication that something's wrong. We just got to know what we're looking for, and we just got to know when to look for it. So we can check off course objective number 3. Course objective number 4 and 5, understand current screening, prevention, and treatment methods, and understand future screening and prevention methods that are under development. We didn't get into specifics of the pharmacological treatments that are under development in the future, but we did talk about the types of medications, their classes, and we talked about memantine, also known as Namenda, and the medications that we use to treat patients' symptoms, because there isn't a drug that just treats Alzheimer's disease perfectly. We still need to be able to manage the symptoms. Screening, I gave you guys information about the SAGE test, and also how we can use that to use that as a method of prevention, and also early screening and early warning signs to look for And our biggest form of prevention is going to be education of ourselves and other healthcare professionals of what to look for and how important and impactful this disease is going to be in our society. So we are done for today. I just want to take a moment to thank you again for choosing myalftraining.com. My name is Deontay J. Marquis. I'm a family nurse practitioner in Southern California. It was my pleasure to be with you guys today and hope to see you back soon. Thank you. Have a good day.